Don't worry, she should be with us shortly. Toya,
Hello.
Toya, is it you? Oh, my. Toya, I'm recording, so we're ready to go whenever you are.
Can everybody hear me?
Yes.
Yes.
Okay.
Yeah.
All right, now Sean, what happened to the presentation that we did?
That is back on the other slide. That is back in the main room.
Okay, so that's for later.
I don't know.
Okay, me either.
All
I
I
did
know is
send
supposed
it
to come
in.
into this room and record. That's all I know.
Okay.
Sorry.
All right. So, no, don't be. It's okay. It's okay. I guess we'll just wing this. But I did have a presentation for the students that were interested, but I guess
You
I
can
could
share your
just answer
screen.
questions.
You can share your screen. Down at the bottom, there's a green button where you can share your screen.
Let's see. I do see that. So let me see if I could just find what I sent her.
Okay.
Um,
Just holler if you need some help.
I can't get this far. All right, let's see. I am getting there. I'm going to. This.
Oh, you're kind of
Okay.
you're dropping out a little bit. Toya.
Say it again.
You're dropping out. You might want to just wing it. You might not want to use the presentation because it appears your bandwidth is pretty low because you're dropping out a little bit.
Okay.
So if you don't mind winging it.
Okay, that's.
Or you could pull the PowerPoint
Okay.
up on your side. So
I
you
don't.
can organize your thoughts.
That's okay. My thoughts are fine. I mean,
okay.
If anybody has a question, we can start that way. Does anyone have a question about the medical assistant program?
I don't know had anyone, but I have one question is what would we do about in this job? What
would your job be?
Yeah.
Okay. I can give you an example. When you go to the doctor and someone calls you back and they take your weight and your blood pressure, and they have you wait for the doctor, that's a medical assistant. If you are asked to do a sample, like a urine sample, or when you go to the bathroom, take a sample cup with you, that's the medical assistant. The medical assistant is also the person that educates you. Like, let's say you have to be on crutches. The medical assistant will be the person to demonstrate how to use the crutches correctly, and provide you with information. If you're on a special diet, let's say you have to fast for lab work tomorrow, the medical assistant will be the person to give you the instructions for that and give you your readings and things of that nature. So there's a large spectrum of what you'll do as a medical assistant depending on where you work. Some places you'll be the person to sterilize the instruments. Let's say you're in surgery or even family practice. That's something that you could do. You
Mm-hmm.
can do billing, doing the patient's billing. So it's just a wide range where if you think about anything in a medical office where
In medical.
assistance is needed, that's not the nurse or the doctor, that's the medical assistant. We're doing that. Everything from giving injections for flu vaccines,
Oh.
giving children their shots when they're babies. We do that as well in the thigh. So
Mm-hmm.
it's a lot. I would suggest going on our website and just looking at a few things.
Mm-hmm.
And I will also YouTube has some great videos of things like a day in the life of a medical assistant, where it'll be an actual medical assistant. She's sharing her day or his day with you, and you can see how it is in different places in the hospital. So I would take the time out just to look at that, and you could really see firsthand. It's just a good way to kind of expose yourself to what happens in the day of a medical assistant from the beginning of the day to closing the office.
Oh, can you repeat the name again on YouTube?
Uh, you could type in a day in the
A
life of a
day
medical assistant,
and all like. Mm-hmm.
life, Life.
Okay, thank you. Yeah.
You're welcome.
Is how long is gonna take us to study this course?
You have two options. You can do the 9-month program or the 12-month program.
Oh.
At the end of each, you get the same certification. So it just depends on your comfort level as far as how fast you want to complete the program.
Mm-hmm. Uh, how much do they pay? Do we need to pay for tuition?
Well, when you first become a Seattle Central College student, part of the process is completing a FAFSA. Most students get financial aid. If not, the program is approximately $8,000. And there's an information sheet on the website as well that lets you know what the fees are, what the tuition will be.
Mm-hmm. On the web, we can check on the website, right? Okay.
And it's a whole sheet of information for you to look at. And there's scholarships and things as well. Our workforce department works with the students to try to find funding for them as well. And you'll see that information on the
It's,
website too.
yeah, it's mean that just like you said, 8,000 is cover 9 months or 12 months is totally.
Correct.
Oh, okay. Thank you. Okay.
No,
That's
it's
just
not
my
too bad.
question.
I said the same thing, but it's really because it's a community college, the fees are a
Uh-huh.
little different because when you hear about medical assistant schools and they have all the marketing and all the commercials and things like that,
Mm-hmm.
they have much higher tuition because of
Mm-hmm.
that. We don't
Yeah.
have those things.
Then how do Seattle Center deal with during the time about COVID? We need to go in class in person or just online class?
Online, virtual.
Oh.
We have to comply with the mandates. So during that time when Governor Inslee was saying, we can't have face to face, we
Uh-huh.
did online simulation. And that's to support students, not just for their safety, but also the reality that we have adult students. So some of our students were at home with their children or taking care of family members. So we definitely support the reality of the life of the adult student. And sometimes you do have to be at home. So we have options so you can continue learning and not having to wait and come back.
Mm-hmm.
So they still
But
graduated in time.
yeah, but something we need to practice with real people, right?
Correct. So what happens is like right now, that wouldn't be a huge issue, but we also have open lab. So let's say
Mm-hmm.
there's a skill set that you're really not comfortable with. Let's say you're not comfortable with injections or blood draws. You can schedule an appointment and go in, and that's more one-on-one. And you can practice. You could practice with the arms, and that's more distance. We do have to practice the social distancing as well. So there's different ways for you to become comfortable in your skill sets, and everyone is different. So, like you said, online learning may not be the route
Yeah.
for you, and that's fine. And that's fine. We do have those options, but I never want someone to feel like they're not comfortable if there's an outbreak or if there's a spike, and you feel like if I don't come to class, I'm gonna fail, and that's not true.
Yeah. Okay. Maybe for my last question, how much do they pay for medical assistant for per hours?
Okay. Usually what's happening now, there's the sign-on bonuses. Sign-on bonuses can be anywhere between $4,000 to $6,000. And medical assistants make anywhere between $20 and $30 an hour. The average salary here in Washington State is about $45,000, $50,000 a year. And I always explain to students, with it being a 9-month program, go ahead, get hired in at a hospital, and then take advantage of the tuition reimbursement if you want to continue on your education. So the other programs that we have housed in Seattle Central, you can continue on, and let's say you want to do nursing or you want to do respiratory care. At least you don't have to worry about that out-of-pocket monies. So I always suggest, do the certificate program and then do tuition reimbursement with your employer. I did that as I became a medical assistant in 1994. But what I did was I got my certificate, then I got my associate's degree, then I got my bachelor's degree, then I got my
Wow.
master's degree, and now I'm getting my doctorate. So and it's just like, and not coming out of any money except for when I got my master's degree certificate. You see what I mean? So I worked in emergency room for years, for like 8 years. Then I went to labor and delivery. Then I did intensive care. So I had a rock star career, but it started with my medical assistant certificate. And I don't have like an abundance of student loans and things like that because I used my employer's tuition reimbursement.
Yeah, very interesting. Okay, thank you for your answer.
Thank you for the questions. Does anybody else have some questions?
Does surgical tech fall under the medical assisting program?
No, but I do know Joni. So I'll
I'm in the
try.
wrong room.
Are you? Oh yeah, then yes. I was about to say I'll try to answer some for you because there's some knowledge. But if you know, Joni is who you want, and she could definitely help you.
Okay, so do you know what room that would be, or is that a different day?
I don't know why she wasn't on the list. To be honest with you, but I would email her. If you want to reach out to her, go under her program, go under the search tech program on the website. Her name's Joni Whitson, and reach out to her, and she'll respond to you about search tech.
Awesome. Thank you. Sorry.
No, it's okay. It's okay. Good luck.
Bye.
Bye-bye. Anybody else have a question? I wish I could pull up the presentation for you. I had 2 of my instructors do bios. We did a breakdown of the clinic and everything. But my weakness is technology. So I always have IT helping me all the time. So I understand when the students are like, I can't get it. It's like, hey, I'm right there with you. I can't get it either. So, that's
Yeah.
one
If
of
you
my
want to
things.
try it, feel free to, because it looks like your connection's better. I haven't seen you break up since the beginning.
And I'm afraid that, what, if I do too much, I think it will start glitching. I had a meeting earlier today and tried to do a presentation, and we were all frozen.
Okay, maybe best not to do it then.
Yep. I think I'll just maybe ask IT to put it like up on on the website, because it'll still be like a nice thing for students to look at if they're interested in medical assistant. I think that'll be cool. I'll reach out to them. Um, any other questions as far as medical assisting? Nobody's gonna say anything. Is it because it's me? Is it the glasses? What about now? No questions? Okay. I could talk about medical assisting all day. You know, as far as when I first started, I was 20 years old, and I worked in the emergency room, and I did traumas that would come in, adult and pediatric traumas. What I would do is assist in stopping bleeding if they were bleeding. That's one of the first things that you have to do when a patient comes in. If they are bleeding, you want to stop the bleeding. I assisted with vital signs, doing lab work, things of that nature. Family liaison, going out to speak to the family, letting them know what's going on. So HIPAA is like a huge part of our job because we are helpers, and it's very difficult for us to see family members in distress, and you want to tell them things, but that's very limited as to what you can say and who you can say it to. You learn those things. You also learn a lot about abuse and how to report it when it's children or elderly, anyone that you suspect may be abused or they're in a hospital because of something like that. And you're trained on how to do that. So it's not like you would have to just figure it out yourself. You also learn how to schedule, how to document, how to be very accurate when you're updating patients' charts, to make sure that you're looking at the right person, and you're going to find your rights as far as when it comes to medication, administration, um, transporting patients from time to time. We don't do it often, but if your patient has to go to another area of the hospital and there's no one to take them, you may do that. Like I said, as medical assistants, you can work anywhere in the hospital, but your scope is limited. So the young lady that was asking about surge tech, um, one time as a medical assistant, I had put in a transfer to work in surgery at the hospital, and I thought I was going to be in there with the surgery, seeing blood and guts and all that. So I was really excited when the transfer was accepted. But my scope of practice when I was up in surgery was simply to get the patient ready for surgery, to assist with getting the equipment ready for surgery. And when I thought it was time for me to scrub in and go into surgery, that was a no-no. That was beyond my scope as a medical assistant there. However, when I worked in nephrology and cardiology intensive care, the only people I really communicated with were surgeons. And if I told them I could not get the blood from the catheter, or if things weren't correct with the patient, then that surgeon would change it out as I would ask him. So there's levels of communicating, which is another skill that you'll really learn. A lot of times when students come to the medical assistant program and they hear, you have to learn to use critical thinking skills. A lot of times people think that you're trying to be funny as if they can't think. But no, it is actually a skill set and part of the curriculum that is from the Medical Assistant Education Review Board about critical thinking. Medical assistants work on their own. You don't usually see, when you're at the hospital, you don't see like a medical assistant supervisor, right? We do a lot of what we have to do independently. So you have to be someone that can really focus and know what your day is going to be about, and really know how to be task oriented. This does not mean don't ask for help when you need it. This does not mean that your team is not there for you. What this means is it's expected for you to have the clinic prepared for everyone. And that's why the medical assistant is so important, because when you go to the room as a patient, and your doctor is doing a service for you, let's say you're going in for your annual exam, everything that doctor needs has to be stocked in the room. The medical assistant does that. So when your doctor is taking care of you and he reaches in a drawer to get something, it should be right there. And believe it or not, that assists with patients being comfortable because they understand that it's organized. Everything that this doctor needed was there. The doctor didn't say, "Oh, I'll be right back. I have to go get a speculum," or "Oh, I'll be back. I have to go get something." No, everything is there. And that is because of the medical assistant. So when it comes to stocking, we also do inventory. We do equipment orders. So this is another part of communication that comes in because you do have your nurses that require certain things. You do have your doctors that have certain preferences. So you learn that. So we do a lot of making sure that the medical environment is running correctly. If you have great medical assistants, you're going to have a great patient experience because that's what we're here to assist with. How about questions now with all that information? Anybody have questions about anything that I just said? Anybody have questions about the national exams and what's required for you to work in Washington State as a medical assistant? Takes more than just completing the program. Any questions about that? No questions about the test, no questions about what you need to work. Because a lot of students think that, once you graduate from the program, you can just go to work. And that's not true with medical
Ah,
assisting.
do you want to get test before you go to work, right? You kind of state test or something?
Yes, you must. So for the
Mm-hmm.
state of Washington, you have to pass a national exam.
Mm-hmm.
For our program, we have it included in the program itself. So you have what you need to start working. So your final exam for the program is going to be your national certification. You'll be sitting for the CCMA. And that's the Certified Clinical Medical Assistant exam. We have a 98% pass rate. So we really do prepare you to successfully pass the test. And then it becomes 100% because usually the one or two students that don't pass, they do get to take it again. There are at times language barriers with the test. So sometimes my ESL students take it again, but they pass it the second time. There's tutoring available in the school because we do understand. So that test is a very huge part of being able to transition from being a student to an employee. We also have externships with every major hospital in Seattle and surrounding clinics. And we try to practice what's called externship to hire. So usually where you're completing your externship, which is 160 hours, some students do 180. You can if you would like. They usually get hired there. So the onboarding process starts really first quarter is when we want you to have your paperwork in. So very similar to when you get a job or if your children go off to school and you have to have your shot records and all of those things, we require those as well so you can go to externship because externship usually leads to employment as well.
Is me 9 months or 12 months? Is how is schedule work? Is you study 5 days per week? How many hours?
Okay, now externship itself is 160 hours, which usually
160. Okay.
160, which is usually 40 hours a week, and you finish your externship time.
Mm-hmm.
The 9-month option is online because you do your externship second quarter and third quarter, and that way you're done in 9 months. Externship is usually during the day, which is the reason why the students that are doing a 9-month option are doing their coursework online and then they're going to externship during the day. For the traditional program, externship is the last quarter, fourth quarter. because again, most externships are during the day. So you're no longer in the classroom during the day because you've completed all your coursework, and now you're doing
Mhm.
externship the final quarter.
Hmm. Interesting. Uh, we just for me, I'm an ESL student. What kind of level that we can start for medical assistant? You understand my question?
You saying what kind of lab?
No, what kind of level? Is kind of level 5, level 6? Which one we can start?
Can I add
Now,
over that? Just the same question I have also.
okay.
Yeah,
Now, as far
what experiences do we have to take this medical assistant? The level we have, even me, I take the ESL classes. So
okay,
yeah.
to prepare you for the exam, because it is online, the national exam is online and it's timed. So what we do for students is we give you the same study tools that are affiliated with the test. So from the first quarter, you'll start getting used to using the online tools through NHA and their study tools. So you'll get used to that. You'll get familiar with logging into NHA, using those tools, and you'll have the same material that's going to be on your national test. So let's say you have a tutor that you work with now. You can show your tutor the material that you're working on, and that can help you break down words or how to study. I had a group of students who spoke Mandarin. They studied together. I have students that speak Tangala. They study together. So there has to be a way that you help yourself understand the material. Um, I support ESL students because these tests, standardized tests, as you know, just from growing up as a kid and going to school, are made for English speaking people. They really don't consider someone that is speaking English as a second language. So for students that are ESL students, I really say study together, network together, find those resources where there's people that can teach you how to study and learn a new vocabulary, because that's a huge part of it. Once you understand what you're being asked, and I know you all get this because it's just can be confusing because of the way the words are or the way the question is asked. So you have English speaking, like I only speak English. But what I know about tests is you can be asked the same question 3 different ways, and it's the same question. You understand what I mean? So just be mindful that we are aware of that challenge. And this is why you can take the test again. Students usually, I mean, if they don't pass, it's usually by something like 4 points. It's really a sad thing, because they really studied hard. And it's usually an ESL student. So that's why I mentioned that really, focus and utilize those resources. But you do get a second chance at no cost to you to take it again. That's my way to advocate for how I know the tests are made, and that you are required to pass that test to work. So I've seen some really outstanding students in clinicals. They do great with their assignments. And then I don't know what just happened here. Sean,
Breakout room's going to
excuse
close
me,
in 50
this
seconds.
list.
Breakout
Oh,
room's going to close
okay.
in 50 seconds, so you might want to wrap her up real
Oh,
quick.
okay. But I just want everyone to know that if you are an ESL student, there's support for you. So you can become a medical assistant that can work in Washington State, meaning we help you pass the test. I hope that helped anybody that feels apprehensive because of that test. I don't want you to feel like that.
Can I contact you? Can you give us put your in chat your address or your contact information?
My email address is